We're on YouTube.
Roy's about to give our producer CPR in a minute. I'm not even ready. Y'all just throwing this stuff at me like I'm prepared. My hair looks like crap. Anyways, today.
Wow, if you remembered that.
I know I did. Today we're doing. Dang it. We went with Candy Stick. It's professional makeup. You know, I'm really just using it because I want to get rid of it. It drives me insane. It's like so not. Look at that. Like, would you want to purchase this, Roy?
No.
I mean, it's okay though. If you like cheap, like it's good for little girls. Or when you're on camera and it's not that close to you.
Does it taste like candy?
No, it's really salty. It's
so
like
candy
super
stick
salty.
lipstick tastes like salt.
It's salty, yeah. So if you're low in salt, maybe if you're looking for like some electrolytes or something.
This segment
is
so
for you.
freaking bizarre.
It really is. It's so stupid.
It is.
But I just roll with
That's
it.
what makes it. It's so bizarre.
Oh, so here I am thinking I'm doing a good job and whatever.
There's that funky fly. Oh, music. Comes on every day at 5 o'clock. Live at 5. We are on Newswire Daily. We've hooked up on Facebook.
And YouTube.
And it is a...
Money?
Monday. Well, I was waiting for you to go.
Manic Monday.
Manic Monday.
I like Manic Monday.
Man, did we blow that one all to pieces. So which one are you going to go with? Which one are we going to go with at the bottom of the hour?
Manic Monday.
Manic Monday.
Yeah.
That's a good one.
Or we can go with Mannequin because I feel like
we broke the story of Mark Mauser with the demand letter that he sent to the Riverside County health official on that. I think it was a Thursday or was it Friday? One of those days. We broke that, or Friday, and he had the demand letter, got it back from both Riverside and San Bernardino County from the health officials, and they backed off a little bit on that. But we have some more breaking news that just happened here a few minutes out or an hour or two ago, and we have the aforementioned Mark MEUSEUR of the Dillon Law Group, and from that has filed I think has actually escalated this little situation up a little bit here in Riverside County. So welcome to the show, Mark. You're on IE Newswire Daily with Stephanie and Roy.
Hey, Mark.
Hey, good to be back and talking with you.
Man, it's
been so long since we've talked.
Yes, Friday we were breaking news, and I think we're going to be breaking news here again on Monday. Tell us what's up.
Well, let's just walk through this whole thing. You know, right before Palm Sunday, Riverside County came out and said, basically, we're not going to allow drive-up churches. And then basically San Bernardino last Monday followed that up with a similar order. And then they kind of modified it on Tuesday. And then on Wednesday, we sent a demand letter basically explaining how how all Americans have a fundamental constitutional right to free exercise of religion, and that these orders that were coming down were not narrowly tailored and were not the least restrictive means, which is what the Supreme Court has said has to happen. And on Thursday of last week, San Bernardino basically backed down and gave a one-time exemption for Easter Sunday. And then on Friday, we saw Riverside County back down and give a one-time exemption for Easter. And so we declared victory, and even while I was talking to you last Friday, me and the associates of my firm were working Friday, all day Saturday and Sunday, preparing a complaint that we filed this afternoon against the state of California, Riverside County, and San Bernardino County, saying that you cannot deprive people's fundamental constitutional rights just because you've created an essential, non-essential list. If a coffee barista can be an essential worker who can practice CDC social distancing guidelines, then a pastor who has a First Amendment right to free speech, freedom of petition, freedom of religion, free exercise of religion, and that's just to start the list. There are 11 different constitutional rights that have been violated by the state of California, San Bernardino, and Riverside County that we went ahead and said, thank you very much for our one-time exemption, but you're still going to court.
Yeah, and I'm sure George Washington, Ben Franklin, Thomas Jefferson were big coffee fans, but they didn't seem to mention anything about coffee or having that as a constitutional right or anything like that. But they sure did on on freedom of religion and freedom of the press and things like that, Second Amendment, stuff like that. So yeah, it makes no sense, at least any sort of logical sense to me and a lot of other people, why all. Not only this, the draconian measures that are going on, and I think we're getting a lot of breaking stuff on that too. But I'm glad that your law firm, and who's the client that you have in this little endeavor?
Well, the client is, we have 3 different pastors and 1 parishioner who are actually the named plaintiffs. But the Center for Religious Liberties is working with those clients to make sure that their fundamental rights are protected. So you can go to the Center for American Liberties, which is libertycenter.org, libertycenter.org, and they are the nonprofit organization that is working with these pastors to ensure that their fundamental constitutional rights are being protected during this coronavirus pandemic.
And this is exactly important for what's going on that. And when we all have more time to talk about this, and get the details on it, we'll do that. But, with the weekend, everything's breaking so fast. But I wanted to get you on to say that because I've come up with a little saying for Trump, Newsom, Cuomo on that. Stand up, be a man, stop the ban. And that's what I'm doing. I mean, what you guys are doing is the same thing. I mean, people are going stir crazy over this, and as we've discussed, they're not looking at the long-term damage this may be doing all across the board on this stuff. So I really applaud you and the pastors and everybody standing up and saying, hey, wait a minute, look at this. Some of this stuff doesn't make any sense. We got to start getting back to normal operations as soon as possible.
I agree wholeheartedly, and that's why, just because we got a temporary victory this weekend, we did not stop. Literally, I spent all day Saturday, all day Sunday with multiple associates. We were, of course, practicing social distance by working on our computers from home and everything like that. But while many people enjoyed their Easter, we were fighting for those religious liberties to be able to file this complaint today.
Give out that website one more time for your for the American Center for what is that?
libertycenter.org.
There you go, libertycenter.org. That's the one.
It is the Center for American Liberty.
Right.
And their website is libertycenter.org.
There, we'll get it right here.
I twisted my tongue on that more times than I care to count.
Yes, it's all so many acronyms and stuff going on, man. It's hard to keep track of them. Thanks for being on, Mark. We'll have you on again later on in the week, and we'll get into the nitty-gritty details as we have more time to really break this stuff down. But again, my wholehearted thanks to you for sticking up for us, the citizens. There you go. I think we. But again, I've got that. So I'm glad they did that. I'm glad they didn't stop or say, okay, we got a little one-day victory on this, we're going to stop. No, there's folks out there that are helping us out in this whole deal. And
Kevin writes in, funny because it wasn't mentioned in the news and people were still not able to go to church as far as I know.
I think the Press Enterprise did do a story on it, but yeah, it was really kept low-key, very low-key on a lot of this stuff. Going across, it's like, and that's a good question. Good thing you sparked you sparked something that I wanted to talk about, because after Friday, thank you, Kevin.
No,
thank you, Stephanie.
You're welcome.
You didn't care about Kevin.
No, I didn't. No offense, Kevin. We love you.
No, it is because after Friday, we had the press conferences. We just came in from the Trump one of that. We gave you the Cuomo one, and that as we've been doing every day. But Friday, nothing. Just Andrew Cuomo, governor of New York, did one Saturday and Sunday. No Trump, no Gavin Newsom, no Riverside County health official, no nothing. Boy, what happened after they started releasing numbers? What did I keep calling it, his dad was governor. What did Andrew Cuomo say at the press conference Monday morning other than these words, and I quote, "The worst is over"?
I thought we were going to have a pop quiz right now. I'm so glad because I didn't study.
And Gavin.
But, okay, so if the worst is over, then why are they still... I mean, I know that they did the expanding before the worst was over, but they don't know what they're talking about. I'm just so irritated.
Well, again,
This
now
whole
that
thing's just stupid. I went to
Yes.
Stater Brothers on my way here to get a little snack. Well, dinner, really. And I have my stupid little mask on, and I cannot breathe with those damn masks on. It's like I'm hyperventilating. Like, I panic. I'd rather just walk around with no mask on. I feel safer. It's pissing me off. Make the mask go away. You do all kinds
That's
of
what we're
crap.
trying to
Make
do.
it go away.
Poof, the masks are gone. And that is a great thing because our engineer that will be joining us at the bottom of the hour, Sean, over at KMET, sent me a little article on that. We'll get to that in a minute. Something about the mask, and that was a great point of that. But again, to put it into perspective, Gavin Newsom was backing way up. Said they're going to, the New York, Connecticut, New Jersey governor had a meeting right after that later on this afternoon. How we're going to, we're talking about opening this up. Gavin Newsom's going to meet tomorrow with the governors of Oregon and Washington talking about opening it up. Glossed right over the death certificate or death stuff and everything. In New York, down, lowest it's been in a while. Hospitalizations way down, not meeting the projection. Same thing in California. Same thing at Riverside County of that. 2 deaths on the last weekend, and that. I didn't get the chart up, but I have an email thread going on. They predicted on April 6th, Riverside County health official, 1,016 cases. And they said it will, in their chart on their website, will double in 5 days.
Did it?
No.
I know it didn't.
They said it will double to 2,032. The number they put up Saturday, which is 5 days afterward, after their 4.5, they said it was going to double 1,600 and change. About a 50% less than what they predicted. And this is using all the stay-at-home models and everything they've been doing. So I don't know if you read it, but you were carbon copied in it. So I got a list of questions into the, again, to
Don't
the
quiz me on it,
Riverside
please.
County health official. And they did finally put us, i.e. Newswire KMET 1490, on the list to ask that, so we are not that. But I
got
don't
put on the media list.
I don't know what is so hard to understand in the English languages. I'm asking, how does this happen? Why? I've been asking it. I asked that about La Granada School. Why? Why the danger? Why no danger of gloves or presenting this? And then I do that, and no answer since March 22nd or 23rd. Why are you ignoring the obvious questions or questions of that? If you have answers for it, because, okay, we're buying your stuff, okay, with all the social distancing and stuff and masks and everything, this gets to your point of why you're wearing the mask. What is the effectiveness of this whole 100% ridiculous lockdown, in my opinion, of doing this stuff? Yeah, there might be certain situations. Yeah, maybe limit it to 10, even of that or stuff. But like Andrew Cuomo said at the press conference, when the reporter asked him, well, why don't you open up the drive-ins? What is the...
They closed the drive-ins?
Everywhere.
Well, I'm glad I went before they closed. Why the hell would you close a drive-in?
That was exactly what Andrew Cuomo asked. He said, you made a very good point. He said, I'm going to look into that because the reporter said, you're in your car. How are you doing that?
I don't think Van Buren was
But
close.
this is it. We should, hopefully we'll be able to play the clip later in the week of that. But so he turns to the health official. Well, what's it? Because he says, that's a very good point. I'm gonna look at that. That was Friday. Or it's Saturday, I think. So he looks at the health official. Well, the workers might be exposed to a blah, 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 blah.
Wear gloves.
Exactly. There's ways around that. And
let
Andrews,
the person put the card in themselves.
I will give Andy Como a little credit on that. He said he looked at it and said, I'm going to take the opposite position, and I'm going to ask that question and look real serious.
It is closed.
What?
The drive-in.
I told you.
Didn't want to believe you.
You can't go to your mom's house, for crying out loud. You think they're going to let you in a drive-in theater? You can't. I mean, it's ridiculous.
Someone needs to get beat with like a ruler.
And not me. I'm the one trying. Yes, I'm trying to help this stuff out, and you're hitting me.
Because I'm mad.
Well, get the Riverside County health official or somebody who's a Como or Newsome or something that's doing all this stuff. No, it's getting ridiculous up and down the line. It's stupid. All this stuff, like golf courses. Golf courses have been social distancing since the beginning of time. You're out there on gazillion acres with three people out there putting a little stupid ball around with a club. I mean, what is the danger? What is the danger going to a park or this or that or anything else? There is, of this. It's crazy. I see no justification for the lockdown, the draconian lockdown that we've had. Like I said, to all of our officials, be a man, stop the ban.
I cannot laugh every time we say that. Say hi to Ann. She said hi to you.
Hi, Ann. So, these Klondikes have got to be put on. I don't know why. A majority of you voted for Gavin Newsom. Jose
don't blame
Medina,
us.
Estienne Gutierrez, whomever on this whole enchilada, Dick Roth, Sabrina Cervantes, that have been historically screwing this state, cities, and everything else into the ground. When are you going to stop voting for these idiots that are doing this? Because if you don't stand up, you're going to get steamrollered over. It's the bottom freaking line. You're going to let them dictate and tell us that we got to wear masks. This is in the USA Today. In February 21st, Dr. Anthony Fauci had a meeting with the editorial board. Again, Sean from KMET sent me this today. Jane O'Donnell, USA Today.
Oh, I'm sorry to hear that, Kevin.
Top disease official, risk of coronavirus in USA is minuscule. Skip mask and wash hands.
Yeah. I like that. Who wrote that? USA Today?
This is their title on what Dr. Anthony Fauci told the editorial board of USA Today. U.S. Centers for Disease Control and Prevention will be testing for coronavirus in people in 5 major cities who show up with claims of flu-like symptoms. If that, if that testing shows that the virus has slipped into the country in places federal officials don't know about, we've got a problem. Dr. Anthony Fauci, director of National Institute of Allergy and Infectious Diseases, told USA's editorial board today. Short of that, Fauci said, skip the masks unless you are contagious. Don't worry about catching anything from Chinese products, and certainly don't avoid Chinese people or restaurants. Government agencies, including Fauci's own National Institute of Health, are being inundated with calls and emails from nervous people, just as they were during Ebola and SARS scares. This is on February 21st, 2020. Skip the mask. Fauci recalled how a nurse who was involved in Ebola took the flight to Ohio because she was asymptomatic and not at a risk of infecting anyone. People everywhere suddenly thought planes were unsafe. That's because you put this rhetoric out there, all that. When you put this, people take this and, they extrapolate this stuff out and take it, well, pretty soon people are unreasonably panicked because of your not explaining or telling them. He's telling them, no, you have no way that you're going to get Ebola. Now, if you can trust this guy, it's not safe to fly on the planes. It's safe to fly on the planes, but everybody's panicking because, you know what? They don't trust these guys because what? In not saying any specific case, but when generally when they're talking to you, a lot of times guys like this are lying to you. In other words, other advice from Dr. Fauci and Dr. Stephen Hahn of Food and Drug Administration includes coronavirus is probably predominantly spread from the air from humans to humans. Inanimate things that are placed in a container in China or sent to the U.S. don't carry any risk of transmitting the disease, neither do medications. Imported shipments are regulated, there is no evidence to support the transmission of COVID-19 is associated with input goods, drugs, or associated humans or pets that have not been any cases of COVID-19 with imported goods. Well, wasn't there the report that a tiger got COVID-19?
Yeah.
So there's, and this is the guy that's supposed to be the guru expert.
But that was back in February, though, right? So, I mean, a lot kind of changed between them. But I do think, I forgot who, I think it was maybe Dr. Victory, thank you. She was saying how the masks are pointless because of what they do is they guard, if you have it, you're not spreading your germs.
So this is what Dr. Fauci said about masks later on down in the bottom of the article. The only people who need masks are those who are already infected to keep from exposing to others. The masks sold at drugstores aren't even good enough to truly protect anyone, Fauci said. If you look at the masks that you buy in the drugstore, the leakage around doesn't really do much to protect you, he said. People start saying, should I start wearing a mask? ? Now in the United States, there is absolutely no reason whatsoever to wear a mask. Fauci doesn't want people to worry, but many are. Well, now why all of a sudden the whole mask deal?
Mark writes in, so if I put pantyhose over my head, is that still okay for a mask? I would say, yeah, go for it. And when you do, let me know so I can go and film it. I would really like to see people's reaction. Classic. Or I'll do it with you.
Wow. I was waiting for you to bring the thong in so I could use it as a mask.
How do you know I have one? We're not even going to get in that conversation because that's just, if we already set up enough talk. Anyways.
But
wow.
if you
my mom was pissed because a lady, she wanted to put the underwear over her head and then clip it and do a video, and someone did it before her.
There you go. And that's what I'm saying is why all of a sudden he's saying mask. Now they're saying put a handkerchief over it. Oh, that'll stop. We're all
it's pointless.
Yes.
The whole thing is pointless, except for hyperventilating because you're claustrophobic.
How did it change in 6 weeks that masks were not effective? And that's what the whole thing was. Unless you're wearing the surgical mask,
You want to bring the mask?
the N95, which you don't want to have because the healthcare workers and stuff really need those. We don't.
See, but like my dad might have had some in the garage that are like old as hell. But then they're saying not to use and to give them to the healthcare workers. Why would you accept masks that are like
Well, I don't
30
know. Maybe
years old.
Yeah. If
Steven writes in really quick because I want to see if you can answer this. He asked and then it went away. Do you guys have any information on what's being done to bring back Americans that are scattered across the U.S.?
Not other than the Trump administration said anybody that's overseas that they would get them out somehow of that. So I mean, like they did with the first flight that came from Wuhan, China to March Air Reserve Base about 2 miles away from here. Was that, we chartered many planes and stuff and got people out. If there are American citizens in dangerous spots, which seems like there isn't much, most of it has went through most of the rest. I don't know of any.
So you still can't fly anywhere or anything yet?
Well, no, the travel ban, which was the smart thing, and Trump said that. The smartest thing Trump did in the 31st of January.
But airline tickets were so cheap. I should have bought mine.
Is on the travel ban is when you're when he did that was probably the smartest thing he did. And remember, he was called racist and stuff. And remember this in January and February. This is when Bill de Blasio, mayor of New York, Cuomo, Pelosi out here in Chinatown saying, oh, it's racist and you got to let these people go in Chinatown and yada, yada, yada. Well, where did it come from? Where did it start? Like you say, there were smart things to do. Trump putting the travel bans in, starting that. He went through that on the press conference today, the whole enchilada on that and explaining that. And Joe Biden, who was roasting his rear end on that, and then later on, about a week or two ago, said, yeah, that was actually a good thing to do of that. And so, again, on all this stuff, quit. Quit. Well, one day, explain to us why one day in February 21st, that's what Dr. Fauci or Dr. Cameron Kaiser, the Riverside County health official, why masks were basically ineffective on February 21st of spreading this or preventing this, to today, where in Riverside County we are under probably some of the strictest, most draconian lockdown measures. I think the only country that is put, the only place that I know of that is even more severe is India, which basically shut down the country for 3 weeks and said nobody going anywhere anytime for 3 weeks. And that was in India.
You know what I'm surprised when people aren't upset about, which I saw a little bit going on the internet, and now I'm going to start something right now, is grocery stores aren't allowing you to bring bags in, right? So now you got to get bags from them, but they're still charging you for the bags.
Yes.
That's kind of messed up.
Good thing you mentioned that.
See, I started something.
See? The cloth bag.
You're not allowed to bring it in.
Yes.
Get that thing out of here. It's dirty.
Because.
Why?
Yes. It has. Sure. These are the cloth bags. All you greenie environmentalists.
And now we're back to what we were trying to leave.
Yes.
Why did we try to
leave
it?
You said these were killing the dolphins, which they weren't. They were actually trying to keep us alive. Because you know what? Even though there's viruses and stuff on these, what you did with these, you threw them in the trash. What you do with these, the viruses survive on this stuff like this. And you know what? Maybe they spread coronavirus and everything else. So you environmentalists are the ones, so-called environmentalists, are the ones that are killing us.
Here, here's something.
Yes, it is guys like me who are the true environmentalists that are trying to keep us the frick alive.
Oh my God, you scare me.
And all you idiot assholes out there, tree huggers that have killed many people up there in the fires by not clearing the forest and all this other stuff, you are the ones that are responsible for this crap. You are the ones, like you said, now you got to pay for bags because we did this, we got rid of them, and now they're saying, well, you know what? It was probably a good idea, and you didn't kill no damn dolphins either. It's a ruse. It's stupid. Quit buying into this idiotic rhetoric. Or I'm going to explode. And that might be a nuclear explosion that will wipe out the whole world. That's something you got to worry about.
I laugh at all the worst times, I swear.
You even got a snort out of that.
Yeah, a big one. Because I was terrified. It wasn't because I was having fun. It was just literally because I was scared. Either I laugh or I pee myself. I was laughing.
1 minute.
Hey, Sean.
Hey. So what's this? You're either laughing or peeing yourself?
I don't know what I'm talking about.
Yeah, that article you sent over, we just went over, just scared the crap out of her on the
Oh yeah,
mask.
wasn't that interesting?
Yes. Yeah, masks were no good or
Hey, Lucy.
ineffective a month or 6 weeks ago. Now we're all walking around and scared to death with the masks on.
Yeah.
How the hell does this work?
30 seconds.
I thought you were going to explain that to me, Sean.
I wish I knew.
Damn.
I'm not Dr. Fauci. Thank God.
Well, that was fun.
All right, guys, here we go.
Yeah.
Go to KMET1490am.com and download your free phone app today. IE Newswire Daily is on the air.
The following is a paid program. Views and claims expressed are those of the program producer and are not endorsed by this station. Opinions expressed not necessarily those of radio station.
Comes in every 5:30 Monday through Friday on the Mighty Red 1490 KMET on a Manic Monday. Hey, we got the timing back on this one. We've been going through that. We broke some news again. We had him on Friday, Attorney Mark MEUSEUR of the Dillon Law Group, American Center for Liberty on that, and some pastors have, they did got a little bit of reprieve, said, okay, on Easter Sunday you can have a few services in San Bernardino County churches could, as long as they did social guidelines. Riverside County allowed Sunday services on drive-in, Well, as Mark explained on that, and we'll have him on later on in the week to get into the nitty-gritty details on that. But they have filed a lawsuit in Riverside and San Bernardino counties against that to allow churches to open up. And as he said, why are baristas and Starbucks or your local marijuana distributor allowed to stay open and serve the people, but your religious freedoms under the First Amendment of the Constitution are not protected, or they're closing down all the churches statewide? On top of that, putting us under probably some of the most draconian lockdown measures in the whole world in Riverside County, where you basically cannot see anyone. You can only go out to get groceries, and you got to wear masks and XYZ and stuff like that. So we just went to we had that on. We went through all that. We went through the Trump press conference and stuff. But we're going to have on here just in about a minute or two our very favorite physician coming on that we've had on many, many times to give you the straight information, facts, not fear. And boy, have we been getting a lot of fear, but it seems like there may be some cracks in the dam on this. But to bring us up to speed on whatever stuff went on over the weekend and stuff, and I got a little question for her here in a bit on masks and Dr. Fauci, but Dr. Kelly Victory, welcome back to Inland Empire Newswire Daily with Stephanie and Roy.
Hey, good to be back with you guys. Thanks.
Boy, did the dam start cracking over the weekend and Monday. I'm going to give you the quote. I don't know if you've heard it, but New York Governor Andrew Cuomo said this morning at his press conference, the worst is over. He was more optimistic about opening things up, so was Gavin Newsom. Trump was talking that serious hints that we're going to be opening this thing up May 1st. All these projections, as you have said, even the ones after the social distancing, are coming in way under even what they predicted on the new models and everything else. What's your take of what's happened over the weekend, Dr. Kelly Victory?
Well, at some point, Roy, the facts are going to be what they are. And that's what I've been saying all along. At some point, you can only carry this charade, so far. And even with the numbers looking as good as they are, quote unquote, I maintain the death numbers have been wildly overinflated. But at some point, it has to come to an end, right? Now, I predicted that they would do sort of a collective pat on the back and say, oh, thank God, the worst is over. We've turned the corner. We've flattened the curve, whatever, you want to use, whatever phrase you want to use. They'll pat themselves in the back and say, thank God we did this. But that's absurd because, frankly, I believe this thing was a nothing from the beginning, which, again, not to say that the virus isn't real, not to say that people haven't died, not to say, Roy, that more people won't continue to die. We will still have deaths from this in the weeks and months to come, and likely again in the fall. It was always about an overreaction and over-response. Not that the virus didn't exist, but that their response was wildly out of proportion to the actual risk, because we have lots and lots of other things that happen. We have outbreaks of influenza every year that cause deaths. We're never happy about it. We don't ever want to see someone die needlessly. But we simply aren't in a position as a country to shut down the entire economy in order to prevent some of those deaths that will happen every year.
We're broadcasting here in Moreno Valley in Riverside County, about 2 miles from March Air Base, where the first flight from Wuhan, China came in for that. We are in some of the most draconian lockdown measures. You can't visit your parents, go anywhere, only go out to maybe get groceries or this, that, and the other, and all the stuff that's going on that. We've got to wear masks outside. This is in a USA Today article dated February 21st, and we went over in the first part of the show. But I just want to read you one quote, and it was the editorial board meeting with the USA Today editorial board and the aforementioned Dr. Anthony Fauci. Masks, he says, the only people who need masks are those who are already infected to keep from exposing others. The masks sold at drugstores aren't even good enough to truly protect anyone. My question is, how on February 21st, masks are basically not effective to this, to if you don't wear a mask, you could kill your mother.
Well, it's actually even worse than that, Roy, because as you rightly point off, they have done a 180. First, it went from we're going to have 2.4 million people die, now down to 60,000. They went from masks don't work to you absolutely must by law wear a mask or you're going to be arrested. They went from we're going to limit gatherings to 500 people, which was based on no science, down to you can't gather in any groups, outside of your direct family in your home. I mean, they have retracted on so many things that once you have done that, you have, number one, totally lost the public trust when you're supposed to be the voice of reason. And number two, as far as I'm concerned, you really forfeit your right to lead this charge because you're no longer credible. And I think it's exactly right. The idea of mandating that everyone wears a mask or that people stay inside. I mean, let's just review sort of a bigger, what I would call a meta concept of public health, which is that of quarantine. The concept of quarantine, Roy, is that you keep sick people isolated from others. That's what quarantine is. When you, on the other hand, when you do what we are doing now, keeping all of the well people and forcing them to stay inside and wear masks and stay isolated, that's not quarantine. That's tyranny.
Exactly.
It's a different word.
Exactly. Do we have a question from one
We
of our
do.
listeners?
Stephen writes in and asks, when is California projected to be open again?
Well, there is a projection right now, unfortunately.
Again, Gavin Newsom was hinting very strongly that they're looking at that from that, and deaths were way down all across the board. Trump said they're flat. Cuomo says they're flat to going down and everything else. Everything is trending down. So that's why I say over the weekend, and that's why I think you didn't see any press conference except for the Cuomo ones over the weekend, because these numbers were turning way down all over the weekend, and they're coming out with this, and they're coming out with more. Yes, let's look at that. Andrew Cuomo in Saturday, and I think you'll get a kick out of this. A reporter asked him, well, why aren't the drive-ins opening? He said, that's a very good point. He looks at the health official. He says, well, maybe the employees would be in danger of that. And Andy Cuomo said, you know what? I'm going to argue against the health official, and I'm going to ask, and I'm going to find out and see if we can open in the drive-in theaters. Well, then we're getting this on Monday with all this and the numbers turning and all that, and the governor's meeting talking about opening up. Governor Abbott in Texas right now is saying, man, he's making some strong hints. We're going to open this thing up maybe within a week.
Well, none of what they're doing makes logical sense or scientific sense or public health sense. Why in the world, for example, would it be okay to stand in line at the Costco with your grocery cart, but not stand in line socially distanced at church on Easter Sunday? Okay? That makes no sense. Why are you somehow safe when you're in the grocery aisle at the Ralph, but you're not safe when you are, standing 6 or 12 feet apart at church? So these things don't make sense. As you rightly point out, the numbers have been falling, the true numbers, the data, the facts, despite how hard they are trying, and God knows they are trying hard to ramp them up and make them sound worse than they are. But even with all of that, the numbers are trending down. Yet, we still are hearing some rumblings that they may extend the lockdown in LA County. First, it's to May 15th right now. I've heard rumblings as recently as this afternoon that they're going to extend it until August. If they were to do that, it's certain death for the economy in LA. And it isn't, once again, based on fact. And as they keep trying to inflate the numbers. They try to make things sound as bad as possible. And even with all of their attempts, the numbers are in fact trending down.
Yeah, I wonder what justification Eric Garcetti, the mayor of LA, has for August, even floating that out there, even going to the May 15th one. But of that, it's like the Riverside County health official. I asked him, and they're dancing around the question. They're finally going to let me in the press conferences or know what that is. But anyway, they put on August 6th, 1,016 cases, and they said it's on that, and I got a screenshot, it will double the amount of cases in 4.5 days. So their latest statistics that they put up on the 12th were, guess how many cases? About 1,600 and change, about 50% less. And I'm asking, why don't you open up how you're coming up with these models and let us look at it? Because every time we keep hitting way under the numbers, how does this make any sense? Even with all the social distancing and all the draconian measures, it's still not coming up with what you said it was going to.
Right, and the models have been wildly off from the beginning for a number of reasons. Number one, we did not know enough about this virus when they started with the models, but they kept doubling down. The biggest misconception is that they've applied the models really in a blanket fashion, acting as if the entire country is a reflection of what's happening in New York City. We know now verifiably, based on the analysis of the different virus strains that are out there, that the virus, the COVID strain that hit New York came largely from Europe. The COVID strain that hit the West Coast came more from China. Different strains, different infection rates, different severity, different mortality, and different populations. We're talking about people in New York who live on top of one another. You've got, 24,000 people per square mile in New York City, where in, Wyoming, you've got 24 people per square mile, maybe on a good day. So they're very, very different. The populations are different. The density is different. And the idea of applying a blanket model across the country as large and as diverse as the United States is frankly patently absurd, and it's resulted in us taking measures in every town, in every city, in every municipality to do things that have destroyed the economy, and largely without any reason. Riverside County, as of this afternoon, tragic as it is, Riverside County has had 50 people die of coronavirus. 50 people drown in bathtubs every weekend. Okay, there are lots of bad things that happen to people, and we don't shut down the economy. So I'm sorry for the people who have gotten gravely ill and or died from this virus, but I will maintain until it's done that we have wildly overreacted.
I agree.
Yes.
I think you worded it perfectly, but it's just, I don't know.
No,
They can't go to August. I'm going to lose my freaking mind if they go to August.
Well,
I will.
I think that, Stephanie, I think the biggest issue is there's this misconception that people are just going to pick back up where they left off.
No way.
When the powers that be, whoever they are, when the czars out there decide, okay, the minions can now go back to work, and they lift this ridiculous quarantine, it's not as if things just pick right back up. I can, certainly, will people start to go back to restaurants? Sure they will. Will people start to go back out there? Yes. But people have taken such a huge financial hit that it will take quite a while before people start to avail themselves of anything that requires disposable income. So going to a movie theater, going out to dinner. People only go out to dinner when they have a few extra dollars in their pocket. If they've been, barely scraping by for months and months, people aren't going to rush out and go to dinner. Likewise, all the people whose quote-unquote elective procedures have been put off in healthcare, that healthy 35-year-old woman who had scheduled a hysterectomy, or the otherwise healthy 50-year-old guy who was scheduled for a knee replacement, those people planned for that. They made arrangements for it. They maybe saved up. They had their vacation time or their sick time. They arranged for childcare. There's no saying that because Gavin Newsom opens up the, to economy again or opens up businesses again, that those people are going to be in any position, having been out of work for months, to all of a sudden say, yeah, I can go off and have that procedure done. They may say, yeah, that was then. I'm not in a position to do that now. It'll be years before I have saved up the time or the money or can arrange to take that time off to do this procedure. So it is not as if you just sort of flip on the switch and everything goes back to normal.
Exactly. I think it was in California. There's 50,000 restaurants. They're expecting 30% or about 15,000 of them will not reopen of this. And even in the medical field, how many hospitals, clinics are not going to be able to hang on to this and not basically having any income coming in because they've been basically shut down for the most part of this. All through the ripple effect of this is going to have, and if we decimate our healthcare system over something like this in our country, well, look at how many lives that's going to endanger, not only next year, 10 years, 50 years down the road.
You're right. Well, you make a good point about these hospitals, Roy. 2019 was already a historic year for rural hospital closures. Rural hospitals were really struggling because they run on a relatively thin margin, as many companies do. But 2019, many rural hospitals closed. Now, with this, because of the mandate to shut down everything that's not critical, to cancel all elective procedures, many hospitals have been laying off people hand over fist, doctors, nurses, ancillary staff, or paying people to stay home. And even the ones that haven't been doing that are saying, shoot, we are essentially empty. And I've seen a number of hospitals actually say, okay, we're throwing in the towel. We can't make it. We're closing. Everywhere across the entire Midland of the United States, those hospitals are empty right now. Why do you think, by the way, that there's been a glut of these obnoxious videos posted on TikTok of hospital workers dancing around or doing choreographed little skits in the hallways, because there aren't any patients. They're empty. Outside of, New York City and a couple of other isolated hotspots in the United States, 98% of the hospitals in the United States are saying, where are the patients? And they've got doctors and nurses. Go look on TikTok at the glut of videos of healthcare workers dancing around, trying to keep themselves busy because they have no patients to see.
I'm such a mess over here with my wires.
Yeah,
I'm getting flustered.
Hopefully, and again, hopefully the numbers and, as you see, the real world data is going to force their hand on this thing this coming week. I'm thinking 2 things. It was really hard in these situations. It's difficult for you to crack this stuff. California, the biggest state, was the first one to start putting this statewide ban in. Texas, our second biggest state, and it's hard to be the first to break it, but I think our second biggest state, Texas, is going to force the hand. And if Texas starts opening it up, I think that will allow the other states, well, okay, they're doing it, and more will feel more comfortable following suit. And I hope Trump does as well, indicate as he did, removing this ban by May 1st. We've got about a minute left. Anything else you want to get out to the good folks in the IE, Kelly Victory?
Well, once again, I will say just stay the course. We are being hampered by an overbearing government. Unfortunately, I would, encourage people to get out there as much as they can, continue to do the things that you do that keep you healthy, get out, walk, ride your bike, get together with friends and family as much as you can, and talk about it. Talk about it with others. Talk people in off the ledge. The idea that we are shutting down the government and the entire economy out of, quote, an overabundance of caution, a phrase that if I never hear again, it will be too soon, that talk about it amongst friends. Encourage people to get facts, not fear. Stop the fear-mongering. Honestly, when it all comes down to it, I think we are going to find that the overall impact of this was less than an average bad flu season, and it's time to get back to work.
Good advice from a great doctor. I really appreciate all your insights on this, because if it wasn't for voices like you, I think all of us would be giving up on hope, so I really appreciate it.
Thank you.
Stick in there. This too shall pass.
You got it. We'll do it again here soon, because this is not over with by any means.
Bye, Dr. Kelly.
Thanks, Stephanie.
Thank you.
Bye.
Mark writes in, which is kind of interesting. I haven't heard of this yet. I always pay my car insurance in advance, and they would not accept next month's payment because they're going to reevaluate contract due to a lot of people saying they're not going anywhere. Which makes sense. Where are you driving to?
Actually, they should be lowering our insurance rates.
They should be.
Because, you're not traveling as well. If you're not going to work and all this stuff, look at the amount of mileage. We're down 40% on oil, gas.
Kevin writes in, his wife insurance is giving a $15 discount.
Well, there you go.
Hey, Kevin, or 15%. Sorry, 50% back discount.
Well, there you go.
Who's your insurance company? We're going to change the show to insurance.
Yes.
Savings.
Insurance. Well, no, that's a very good
Newswire
point.
savings.
That is a good point. If you were driving, what the average person drives with, like 15, 20, probably
Imagine
20,000.
the people that drive all the way out to L.A.
In California, it's got to be more. It's probably like
Lynn
20,000.
writes in that hers went down. Wow, I'm jealous.
Yeah, well, it should. It should. You think of people are on. Look at them. I mean, look at the road. Now, I will say, I think people are still
Theo writes in and says Geico's going down too.
Well, there you go. I will say this, because you can see it on IE Newswire Daily. I covered a little crash that was on Paris Boulevard and Eucalyptus. But from last Sunday, about the same time, because I was out on the road then, there was hardly anybody. And I'm saying not that it was its usual traffic, but I would say it was probably about 50% traffic of what it usually is on Sunday about 4:00 when I was up there. There were cars coming both ways, back and forth on the deal. So I think I seen more activity or stuff for people moving around a little bit more this weekend than last weekend.
I did too, but I think maybe because it was Easter weekend.
Could be, but where were you going to go?
You think? Well, apparently not a lot of people were listening.
Again, like I said, I think I see a lot of people that were saying, yeah, we should do this.
I think a lot of people were worried at first, and I think
Yes.
now they're kind of like,
where's the big, again, and this is
what's going on here?
This is what the rebound and the boy that cries wolf syndrome is. If this doesn't pan out to be the big, great, pandemic that was going to kill us all, or 1 million people, or 100,000, or 250,000, or a million in California, as Gavin Newsom said, yada, 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 and it turns out to be way less than this, I don't think they're going to be explaining this on social distancing and wearing a mask that Dr. Fauci said.
But that's where we need to think, hey, you know what? It was silly, but at least we all stayed inside. We learned how to wash our hands correctly. We learned how to not stand up against someone like this at a grocery store, breathing on them. I mean, we got to kind of look at our gains on all of this. Maybe we did save a lot of lives by staying inside. You got to look at it positive, Roy.
Or maybe we're going to cost a lot more in the future.
Well, we are, but you got to try to look at it positive. So that way we don't start a riot or something.
Maybe we should.
No!
Trump, Cuomo, Newsom, and all you leaders out there, be a man in the band. We're done with this. We're not going
I wrote it wrong earlier.
We're not going to stand for this.
Oh my gosh, you're going to totally start a protest. I can see everyone outside with signs. Be a man. Stop the ban. Oh my gosh. Look at what you're starting.
Yes. That should be that we should be shouting that at every press conference. We should be picketing that in every place across the board until they stop this madness on us. Right? You want to say yes.
He says, yeah, Roy. LOL. Theo, don't encourage.
You got.
I think it's a great protesting, chant. I can totally see people doing it. I'm not joining you on it, though. I don't want to get sick.
You're not.
I'll bring the mask.
You got, as we say,
we're gone. Sanitize air. Shh.